Well, thank you, Richard. That was a very interesting selection. Benny Shapey. Very interesting, particularly seeing we're talking about weight management and body shape. So welcome back to Better Health, and we're talking today with naturopath Wade Stiller about metabolic syndrome. Wade, let's talk briefly about who this syndrome is most likely to affect besides me.
Yeah, thanks Jeff. Well, metabolic syndrome is certainly becoming more common, both here in Australia as well as in the US. Look, science is still searching for a given cause, and this is, in my opinion, they're never going to find it because it's a combination of bad lifestyle and eating habits. One risk factor that's related to every single case is obesity. Now, there can be a number of reasons for obesity, but in the majority of cases, the bottom line is it's either a lack of education relating to exercise and diet, or a choice to ignore what we've been taught about exercise and diet. So to me, the vast majority of metabolic syndrome cases can easily be avoided with some simple education and maybe a little accountability for those who know they get lazy with their eating and lifestyle.
Yes, I saw you glance over at me there, Wade. Well, that's easy to say, but for most of us, life really does get in the way. Like, I get a little busy from time to time, and going to the gym and jogging every day, it's not that easy. Even finding the time to prepare a home-cooked meal or even just plan for a meal is a big ask for me, mate. Yeah. And probably for all our listeners.
Oh, look, yeah, don't get me wrong, I understand completely. I mean, when I got married, I put on almost 2 stone in the first year because, my social life slowed down, and all of a sudden I was spending most nights at home eating a lovely, well-cooked meal with my new bride. And it's, it's been quite an effort to strip some of those kilos off. But we've got to ask ourselves, sometimes, which is more important? Is it our lifestyle or our health? Missing an extra hour of TV a day, or walking part of the way to work. For some, even cutting back from 60 to 55 hours a week. Now, in order to look and feel better, it's nice, but when you think that 10 years down the track, today's choice will probably have a major implication on your health, that to me is worth the change.
So is metabolic syndrome something that people grow into?
Kind of. Yeah, the risk factors for metabolic syndrome include ageing, hormonal changes, lack of exercise, and genes. As some people have genetic weaknesses in the areas of cholesterol production or high blood pressure. So the older we get, the higher the risk. And of course, we all go through hormonal changes once we pass middle age. So identifying things like unhealthy waist-hip ratio or high BMI, and working towards changing bad habits that we've already formed as soon as possible, it's a really easy way, and it's an effective way to lower one's risk, of the common factors.
Obesity.
Obesity it is. Look, and probably the saddest part when we look at who is at risk is the fact that the age of people being diagnosed with metabolic syndrome is actually coming down. The number isn't, but the age is. And there's really no excuse for us here in Australia. We've plenty of money to feed ourselves correctly, plenty of awesome weather to get out and be active, and the information that's available to us is everywhere. Yet we're seeing the number of obese children climb every year. There was a time when we called diabetes 1 childhood onset diabetes. But now diabetes 2 is becoming so common in children that it's no longer adult onset diabetes. Now we just have type 1 and type 2. Jeff, these are chronic diseases that affect children here in a first world country, and it just shouldn't be. And I know some, they talk about genetics and blame genetics, but to me, the vast majority of it, it's all diet and lifestyle.
Right, yes, it's very serious. And you mentioned changes in hormones being a risk factor. How can this make one more at risk of diabetes or high cholesterol?
Well, this is the complex part. The body uses hormones to affect changes through all stages of life. The most obvious being adolescence and menopause or andropause for men, but also for small day-to-day tasks. Our wake-sleep cycle, our stress response, our metabolism, bone density, growth and repair rates. The list goes on. But the point I'm trying to make is that basically everything that comes in contact with our body causes a hormonal response in some way, shape or form. hormones aren't just things us men complain about in women every month, or things that give us acne in high school. They're much more than that, and they're influenced by everything around us. Things like plastics, medications, food, parabens, skincare products. Even some food preservatives have an effect on estrogen receptors alone within our bodies. That's both men and women. So our hormone production is something that we really need to nurture and balance. It needs to be supported all the way through our lives as hormones interact and mould our growth and body maintenance. Of course, insulin, it's another of these hormones, and most people these days have some knowledge of insulin. It helps regulate our blood sugar, I should say, to get into the cells. We also need magnesium for this to happen. But the more sugar we eat, whether it be because we need the energy burst, or maybe we just don't realise how much sugar is in the food that we're eating, or heck, we've just got a sweet tooth, our body doesn't care. The reason behind the why is completely irrelevant. When we eat sugar, our body pumps out more insulin to allow that sugar into the cells so that energy can be utilised. If this goes on long term, our cells eventually decrease their insulin receptors and we eventually become insulin resistant. So sugar can no longer get into the cells effectively to power them. As a result, our blood sugar levels rise, which means our blood pH levels drop or become more acidic, and this can play havoc on the body, causing all sorts of damage to our kidneys, our eyes, our nerves, our brain, and our blood vessels.
So does this have an impact, Wade, on other factors associated with metabolic syndrome?
Yeah, absolutely. When our blood sugar and insulin levels rise, we often get a rise in triglyceride levels, and our cholesterol levels also change.
In what way, mate?
Well, we've all heard about good and bad cholesterol, right?
Yeah, we sure have.
So one of the jobs of the bad cholesterol is to patch up the damaged areas in our artery walls. Now, I just mentioned before that raised blood glucose levels can play a part in this. We all know that eating too much saturated fats can cause hardening of the artery walls. Well, our bad cholesterol, or LDL, starts off the healing process when our blood vessels get damaged. It's actually a very important compound in our body. So when the healing process is underway, our good cholesterol then comes along, that's the HDL, it comes along and mops up the LDL, along with any damaged cell fragments, and they get filtered out by the liver.
So the more damage our arteries have, the more LDL we make in order to repair and recover. It's like a protective mechanism, is that right?
Yes, spot on, absolutely. That's why our LDL-HDL ratio is so important. If there's not enough HDL to scavenge that LDL, our arteries clog up and we end up with a stroke or whatnot. What intrigues me though is that rather than look at this ratio and view it as a marker for systemic health, it's often sold to us as something that needs controlling. Why not just work out why the balance has occurred, or the imbalance, has occurred, rather than block the LDL itself.
Oh, getting a little bit controversial there, Wade. I think this would be a good time to have another song break.
Okay.